We're talking science here. We're in the middle of the new season of UTMC's podcast. It is called Prescribed Listening. Some members of your podcast have been on the show before, and this is a way to kind of get that real life information, right? Not the technical stuff.
It is, yeah, exactly. We have two very esteemed members of the University of Toledo here with us, Tessa Lackey and transplant surgeon Dr. Obi Aquena. Thank you so much for being here.
Yeah,
thank you.
And I heard you laughing at us. You knew, right? It took everything you had to not say the answer, right?
Hey, but you guys got to the answer.
All right.
Tina was right.
You got the answer.
So, Prescribed Listening, this is a podcast that UTMC puts on. We do know this. Tessa, you are going to be the new host of this podcast, and this month's theme is about organ donation, correct?
Yeah, so we just did an episode about the truth, we call it the truth about organ donation, or living organ donation.
Okay.
And we're specifically breaking down different myths and misconceptions that a lot of people have around living organ donation. Like, for example, we had talked about how, you ever heard how with living organ donation, if you end up getting taken to the hospital, that doctors aren't going to fight to save your life as hard, right? So, and then we addressed this myth, and Dr. Aquena, do you want to kind of address what we talked about?
Yeah, so, the question was, what if you were in an accident and something happened and they find out that you're, on your license it says that you're a donor. People are going to just, oh, this person's a donor, let's get the organs. No, that's a myth. The first responders, the trauma surgeons or the trauma doctors, trauma practitioners, their goal is to save everyone. So once you come into the hospital, even before you get to the hospital, the idea is to make sure that we do all we can to restore life to that individual. And in the event that something where that individual does not make it and they're an organ donor, then that conversation is had with the family and move forward. But it is a myth.
Yes, and then one of the things we had talked about too was when that does happen, doctors don't even know your name. They don't know who you are. All they're doing is trying to say, okay, someone's hurt, we need to take care of you and make sure that you're all good. So, and then one of the other things we had talked about as well was all the different programs that are available through living organ donation that, I mean, to me were just like, this is a thing.
Yeah.
Like will you tell that story that we had talked about with the grandfather and the son when it comes to organ donation and what you're able to do?
Right. So first of all, I mean, I think the main point is that living donation is safe, right? It's a safe procedure, for people to that want to donate their organ. So it's a safe thing to do. What you were kind of talking about, what we mentioned was that, say you had a grandfather, who has a grandson. The grandson is going to have kidney disease in the future, right? Grandpa is about 65 years old, and he wants to, do something now, donate his organ now, and for his grandchild who does not have kidney disease. So there are programs, there are different ways that we can, sort of assure people that, they can have assurance for their family member, so to speak. So that there's a program that allows for that. That allows for grandpa to donate today, and in the future, his grandson, if the grandson needs a kidney, we'll be able to get a kidney transplant.
Okay, so that would cut down on wait times and time on a national registry, that type of thing.
Absolutely.
So for in this grandfather's example, while he's in a place where he's all good to donate and why not, he can save someone's life today on the transplant list, and then his grandson, depending on what happens with his kidney disease, he would be able to receive a kidney because his grandfather donated.
Absolutely.
Like it makes you emotional almost, like just thinking about that stuff. And then we had also talked about different things like what was some other programs that we had talked about?
Yeah, so I mean, the overarching theme is that we have a lot of people that are waiting for a kidney transplant. There's 100,000 so people waiting for an organ. 80,000 plus are patients who are waiting for a kidney. Last year, there was a record. Yes, we did about 40,000 kidney transplants around the country, but that leaves about another 40,000 patients who are sort of languishing on dialysis. And so the way to bridge that gap is to increase living donation, right? And so a couple of things. One, as I said, living donation is safe. Over the past, since 1954, 1954 was the first time someone donated a kidney safely to their brother. This was in 1954, and that individual lived a normal life till they passed away of natural causes.
And they were telling us to wrap. The second
Yes.
would be, you said there was two. That was the first. The second.
Yeah. I mean, and so that's number, yeah. So living donation is safe, right? And we need to encourage more people to come forward and donate to help get people off dialysis.
So you can call UTMC and talk to our pre-transplant number, and we can, if you have any questions about organ donation, through UTMC as well.
All right. Well, Tessa, thanks so much for coming.
Yeah,
Dr.
thank
Aquena,
you.
thanks for being here with us. You can learn more about prescribed listening on UTMC's website. You can also download that in your app store. Thank you both so much.
Thank you.